Hello and welcome to this recorded presentation for the employees of Professional Safety Solutions. The employee benefits plan beginning May 1st, 2024, going all the way through April 30th, 2025. My name is Bill Hammett. I'm honored to be your insurance broker. Me along with Anna and Araceli and the rest of our team is here to support you now through open enrollment and out throughout the year. If you've got questions, if you need answers, feel free to reach out to myself or Anna. We'd be happy to help you with the plans that are available to you and any questions that you might have. Just a quick agenda. We'll talk about the timeline, the medical plans available. We've got some new dental and vision plans with MetLife. Talk about enrolling, which is going to be the same way we've always done it. And if you have questions, if you need answers, we're here to help. So open enrollment starts March 29th, goes through Monday, April 8th. This is the time where you can enroll in benefits, waive benefits, add or waive dependents, change plans, upgrade, downgrade, whatever it is you want to do, this is your time to do it. Any changes that you make will go into effect May 1st, 2024. So even if you log in right away and make changes, those changes will actually not take place until May 1st. So that's important to note. We're asking that everybody complete all of this enrollment stuff by Monday, April 8th, and you will do so in the online ease benefit portal that you've been using for the last few years. So we're keeping everything staying the same with Anthem Blue Cross California. We've got 8 plans, 2 bronze PPOs, 2 silver PPOs, 2 gold PPOs, and for our California employees, we have 1 silver HMO and 1 gold HMO. Now, just like last year, you're going to see these select PPO plans, a bronze select plan, a silver select, and a gold select. It's super important to know that these plans have the identical benefits as the full PPO. So when you see that bronze PPO 60, 68, 50, 40%, and the bronze select PPO 60, 68, 50, 40%, it's the same benefits. The difference is the network of providers. All right. So why would you choose the select PPO? So it's going to be a little bit lower cost. It's the same exact network of benefits like we talked about. The select PPO in California has about 40% of the physicians as a full network. So a little less than half of the full network. But here's the key. For those of you that reside outside of California, I want you to make sure you select the select PPO plan, because when you are enrolling in this select PPO outside of California, you have the exact same full PPO network that everybody else would have if they took the full plan. All right. What's happening here is that Anthem Blue Cross has created this limited network PPO plan for California employees to save some money there. But it's kind of a little hack, if you will, because if you enroll in the select PPO outside of California, you're really just enrolling in the full Blue Cross Blue Shield network, the PPO network that is national and across the whole country. So it is kind of a hack, can save you a couple of bucks. So make sure if you are residing outside of California, you choose the select PPO, save you some money. The benefits are the same, and it's the full PPO network from Anthem Blue Cross. So that's important to note. For those of you that are inside of California and you want a PPO plan, I would steer you towards the full PPO. So where it says, this just says PPO, it doesn't say select. So the full PPO in California is what you want. Select is great for those of you outside of California. So let's talk about the plans real quick. So you'll see our bronze plan is going to be the highest deductible. It'll be the lowest cost plan, but just beware for things like doctor visits, x-ray lab, imaging, hospital stay, emergency room, all this kind of stuff. You have to pay 100% of the cost up to $6,850 before you get any benefits. All right, so this is truly just a catastrophic plan. The silver plan is a really great value. This is a good option for those of you that need a PPO plan, that want lots of choice, that don't really mind the deductible, because all you're going to use it for is maybe a doctor visit or two, maybe some prescription drugs. In this case, the silver PPO plan is a fantastic value for you. You've got copays for doctor visits, you got copays for lab and x-rays, you got copays for prescription drugs, all of it. The gold PPO is going to be your best PPO benefit plan. It's got a 0 deductible. It's got much lower copays for prescription drugs, for doctor visits, for x-rays and labs, but it'll be the most expensive plan available. So those are your, it shows you 3 plans here, but just keep in mind there's 2 bronze, there's 2 silver, there's 2 gold. So this is 6 different plans. Again, for those of you residing outside of California, you're going to want to lean towards the select plans. All right, for those of you in California, I would recommend the full network PPO plans. For those of you in California, we've got our HMO plans. HMO plans are great because they don't cost quite as much, but they really limit the providers you can see. So we have our silver plan and our gold plan. Silver is going to have a higher deductible, higher co-pays across the board, and the gold plan is going to be the best benefits we have available for any plans, especially when you consider the hospital stays, a flat dollar copay, surgery, emergency room, all flat dollar copays. So it's very important. Again, HMO plans are only available for those of you residing in California. Here's a little, the Sydney app, so a plug for the mobile app. The single most important thing you can do to improve your experience with healthcare is to download and make sure you have the Sydney app on your phone. This will allow you to do tons of things, look up claims, communicate with doctors, schedule appointments, find urgent care facilities, understand your benefits, tons of stuff right there. Using Sydney, you can actually talk to doctors 24/7. So really great option for those of you that have needs to speak with a medical provider, but not necessarily so much so that you need to go into a doctor's office or a hospital setting. Part of Anthem's offer that is free with the program is an employee assistance program. This is a really great option for those of you that have anything from needing some mental health assistance or dependent care, daily living resources, financial consultation, ID recovery, legal consultation. So really fantastic benefits here that are a great place to start for anybody that is needing any sort of assistance on a variety of levels. So really fantastic additional benefit embedded into the program. Let's talk about dental. So we're moving away from our Choice Builder arrangement, which did offer us MetLife Dental, but then also VSP Vision and all that kind of stuff. We're consolidating all of it together. We've got one HMO dental plan now. Dental plans, this is only available for California employees. And for HMO dental plans, again, very low cost, but very little choice of providers. So sometimes it can be a challenge to find providers. But the benefit is you never run out of benefits. There's a copay for everything. Preventative is covered 100%. So really great benefits here from the dental side. Our PPO dental plan, we've got our one dental plan, really good benefit. We're adding orthodontia now to the PPO dental plan, which is fantastic. And everybody has a $2,500 per enrolled member maximum benefit, which is an improvement to what we had last year. So really nice there. Keep in mind, this is a new plan. Even though it's still MetLife, it's still going to be using the same network. It is a new enrollment. No big deal. It'll be pretty invisible to you. You'll just go through the enrollment process on ease and choose that plan. We have a new vision plan with MetLife as well. Again, consolidating some of these benefits so it's a little easier to use. One ID card. Our vision plan has a $15 eye exam available to you once every 12 months. You have a $180 allowance for frames once every 12 months, a $30 copay for lenses every 12 months, a $30 copay every 12 months for lens enhancements. And then down here at the bottom, we've got our contact lenses instead of the glasses. So up here, we have a $180 frame allowance. That is an or, this is an or. So you get either the frame allowance of 180 or the contact lens allowance of 180. All right. So for if you need elective lenses, it's a $180 allowance. If they're necessary lenses, it's no additional cost after you pay for your eyewear copay. Okay, so very good vision plan, similar to the platinum level vision plan we had before, but actually cheaper by several dollars. So fantastic option here. Additionally, we have our Unum benefits. So we have our California and our non-California disability benefit. This is paid for 100% by ProSafe. ProSafe also pays 100% for the employer-paid life insurance. All right. There's additional voluntary term life insurance that you can buy, but for most of you, it's going to require an evidence of insurability. Okay, so If it's your first time enrolling, you can get up to $40,000, no questions asked. After that, if you didn't elect coverage last year and you want it this year, it will require you go through what's called an evidence of insurability form. So keep in mind that that's going to happen for you, and look out for that email from Unum or from our team indicating that you need to take an extra step. The enrollment portal is now open. All of you should have received an email inviting you to log in and enroll. Most of you should be familiar with this portal. This is what we've been using for several years. The URL is prosafe.ease.com. You do not need to wait for this email. If you're having trouble getting the email, check your junk folder. If you're simply not seeing it all, go ahead and log in. If you remember your username and password from last year, go ahead and do that. If you have any challenges with that, reach out to Sherilyn, reach out to our team. We're happy to help you get your login all squared away, get you back installed in the system if you can't get in. And if you've got questions on navigating that system, we're happy to help. Okay, so that's how you're going to make all your enrollments, all your changes. The costs for all of these plans are embedded into that portal, as well as all the benefits. So you'll be able to look at all that stuff side by side. So next step, be looking for that EASE invitation in your email. You will click the button, you'll log in, and you will enroll. Please do so before Monday, April 8th. And if you have any questions, if you need any answers, we are here to help. Go back to the very beginning of this presentation. You'll see our contact information there. Feel free to reach out to me. Feel free to reach out to your HR team. We are all here to help. We want to help you make good decisions. We want you to be educated on the benefits that are available. And we will definitely make sure to make ourselves available for you to help you make good decisions for yourself and your family. Thank you for paying attention to this webinar. I appreciate your attention. It's an honor, like I said, to be your broker, and we take it very seriously. We look forward to speaking with you and helping any way we can. Thank you so much, and have a great day.